Welcome to Advanced Neurospinal Solutions and Advanced Longevity Solutions. I'm Dr. Roger Elmer, and we're back in our clinic talking more about the balance, cognition, and movement therapy systems that we've now added to our clinic. 3 new lanes of service to go along with our structural correction and functional neurology. The fun part about this is we show fairly quickly the results that we're able to get, and the patients are just raving over it so far, and we've only been doing it for a little while. But today, last few times we talked about our EV, the evaluation system, where we do an evaluation before we ever start anything. We're checking. It's like an EKG for your balance, and it gives us actual data that we can compare, in subsequent times. It'll also tell us, what do you need? Do you need anything in the first place? And that longevity includes these 3 factors, and in those factors, as you lose those things, there aren't good technologies out to bring those back, especially together. And that's what drew me, one of the many things that drew me to this technology, is that we can work balance, and we can work cognition, and we can work movement. And I already do that. But this, it very elegantly works all 3 together and allows us to get, and not just an increase in those neuronal pools and their activity and connection and connectivity, but also creates a more robust connection between those pools, because there's a heavy relationship between balance and cognition. There's a heavy relationship between movement and balance, which is related to cognition. And so we want to boost those. We want you to have better balance than you've had in a decade at least. We want you to have the kind of balance that we can springboard from. What's the phrase, Melissa? Invest.
Oh,
you
invest in your incline.
Invest in the incline
of your health,
or
you will be investing in the decline.
You will be managing the decline of your health. And so we're here to press those systems to get them to function better, together, to create a more robust overall system that's something that you can maintain long term, to give you true longevity, true movement. You would feel younger if you could move better. You would feel younger if you had better balance. You would feel younger if you could think more quickly. And all of those things are things that we focus on, and we test them, and then after we test them, we do the therapies for a while, and then we retest with the same test, so that if you test somebody with the same measuring device each time, that's very accurate. And so that's how we function it. So today we're doing motion. We're going to show you the MMT, the mechanical motion therapy tool. I guess I'm not supposed to call it a gun, but I'm going to call it that anyway. But the mechanical motion therapy tool is there to cause an increase in activity at an area. Like, let's say it's your shoulder, and you're going to see that today. We're going to do the shoulder, and we're going to put input into the mechanoreceptors, the pressure receptors in the area, the nociceptive fibers, which we tend to call pain fibers, the thermal receptors. It's going to affect the joint mechanoreceptors, because we're going to be in motion while we're doing this, and also the muscle spindle fibers. And the muscle spindle fibers are so unique, because they're the primary driver of brain activity, the level of drive of your brain. So now we can see the connection between your movement capacity and your ability to drive your brain, the level of that drive. When that starts to wane and get less, all of a sudden the part of your brain that goes to that area, like let's say it's your knee, there's a knee area, and if that knee isn't functioning very well, you're getting less activity to it, and as you get less activity, it's not functioning very much, and therefore it's going to decrease in its activity. Its circuits are going to lessen. If you don't use it,
You lose
you
it.
lose it. Very good. That's a law of biology. And so, and when we use it, we're increasing blood flow because it needs it. But if we need it less, we're decreasing the potential for that blood flow. We'll decrease the number of capillaries. We'll decrease the effusion rate, which is the ability for the capillaries to supply blood flow to the area and pick up the toxins that are gathering up, and it begins to get smaller, and we say, oh, it atrophied. Yes, that's the term we use, and we think, oh, it got smaller, that's what atrophy means. That is not what it means. It means no nutrition, atrophy. And it's atrophying because we're not using it. And so often when patients come into my office, their joints aren't moving very well, if at all. And as we get them moving, all of a sudden, they brighten up. All of a sudden, they have greater energy in their eyes, they're greater function, they think better, they think faster. And so that's why this is so important. And that's why these three things are so highly integrated and so focused together. Why putting those three together gets us the ultimate output. And one of the things we're going to go over quickly is that we're actually going to do some things to turn your brain on and to turn it up before we actually do the therapies. And I have many different ways to do it, but this tool will do it. And we're going to stimulate different parts of your body and cause them to increase the activity levels up those nerves into the spinal cord, up through the brainstem, into the brain, and cause those areas to increase, but also to increase in blood flow. You've got to supply fuel to whatever it is you're going to do. And we want to cause what we call adaptive plasticity. We're going to force it to get better, those cells to change internally, to connect to one another, and you say, well, I'm getting old, and therefore it's not going to work. So no, it'll work until you're dead, then it won't work, right? As long as you're alive. And it's more important, the connections, how many connections you have, than the number of cells. We're born with 87 billion neurons, but we lose about 10% every decade. But it's really the connections. And each one of those cells has an average of 30,000 connections, which is 2.1 quadrillion connections. And so we're interested in what you have available, which is what you have left over time, creating a significant increase in connection so that those connections will improve the function. It'll also improve the need for blood flow, which will create what we call angiogenesis, which means you'll get better sprouts in the blood vessel system, more capillaries, more efficient perfusion rates, and that, so that you can supply the blood flow in need, in time and in need, to the area that needs it. Okay, well, that was a postdoctorate explanation of what we're about here, and that this is a piece of equipment that goes with the MMT, and there's some really cool things about it. We give our questionnaires. We take significant history to know what we're dealing with and to get a picture of what's going on for you. But also it's an input area that you can get actual education on what each of these things are, what they do. Specific areas, like let's say you got a shoulder problem and you want to deal with that shoulder problem, we can go to an area that will give us an ability to select the shoulder, and it will give you educational parts of it. It will tell you about what it needs, what we do for it, what are some of the exercises that we do, and what are the home exercises that we're going to have you do, and all that. And so this is a handy tool to help us, to help you understand with great clarity. If you got a shoulder problem, you don't want to keep that shoulder problem. You want to get rid of it. You want it gone. If you're, whatever it is you're doing, if you're a golfer or a pickleball player, or if you're a hiker or a biker or whatever you choose to do, we want that thing to function, and we want to be able to maintain it. You want to be able to maintain it after we're done. And that's what we're into here. So we're gonna be showing, I'm gonna turn the time over to Melissa. She's gonna be showing how to use the tool. She's gonna be showing how to warm up the brain by affecting the proprioceptive system, which is on the body with the tool. And imagine all of that information that's coming up. Just imagine the spine. 400 million nerve fibers that are coming from the spine to turn up our brain, to turn it on, and that. And so she's going to show you how we do that, and then she's going to do several areas to give you an idea of what are some of the things that we do. We're going to use the tool to stimulate that area, but also you're going to be moving while it happens. It's a mechanical motion therapy. We are about motion, not just about, well, it feels a little better. We want you to move.
Okay, so I'm going to ask one of our patients if she would be willing to come up. So the first thing we're going to do is we're going to wake up her brain. So I know Doc just gave you all this medical jargon. I'm going to tell you in simple words what it is. So we're going to do brain body, which is our first exercise. We're going to wake up the brain. So our MMT gun is, it's like a light switch, okay? When you turn a light switch on, the light comes on. But if you don't have electricity going from the light switch to the lights, they're not going to come on. So the gun, the MMT, is the light switch. The movement that I'm going to have Audrey do is the electricity that is going to go to the brain, causing the the blood flow to start working. She's also going to be doing some eye movements. The eye movements actually get the cerebellum working, which then helps fire the neurons through the whole body. Is that right, Doc?
Yep.
Okay, good. Glad I got that right. Okay, so her eye movements she's going to be doing, she's going to be looking up for north, down for south, left for east, right for west. And she is not going to move her head while she's doing that, okay? Now, I'm going to be, normally, I would be hitting 3 points on her for this one, okay? I'm actually going to turn her sideways just a little, turn towards me just a little bit so that you can see where I'm taking it on her, okay? And we do this before we start the therapies because we want the brain awake and working and functioning, okay? Alrighty, so go ahead and go. Okay. I'm only gonna do the one side today, but that is, I would do the same 3 on the other side, okay? Now, then we would go from this, we would go into doing some of our fun therapies, which I showed you last week. So something that really exciting happened this past week. Had a patient who said, I'd been working on her hip, and she said, my IT band is so tight and hurts when I walk. So I used the motion gun on her and did it just on her IT band, had her walk, and she's like, I don't have any pain. It was amazing. Have another patient who's a scoliosis patient, a pretty severe case. And she came in last week and had wrote on her chart, no pain. We've been doing this for about 2 weeks on her, so she'd had 4 treatments. No pain. She said first time in 7 years she'd had no pain. That is amazing when you live with pain constantly. I want to just real quick tell a little thing about our evaluation machine. Had a patient who came in, got evaluated with her son, and signed up for the program, and before she could have her first treatment, she was walking into a church and she fell. And she said, as I was laying there on the ground, all I could think was, I fell on the side they said I would fall if I fell. And my brain went, that's so cool. It wasn't cool that she fell, because she was hurt pretty bad. But it was cool that our machine, our evaluation machine, pinpointed what direction she would fall, what position she would fall if she fell, and it was correct. So for me, that gave me a lot of confidence that the tests that we do are accurate. Okay, so now we are going to have Audrey take a seat, okay? So, Doc, can you make sure she's in the camera, please? So what we're gonna do is, we're gonna do just one side. We're gonna do, for a rotator cuff injury, can be a tear, can be the fascia scar tissue that tends to grow on arms. So we also have another patient who came in, and when she first came in, this was all she could move her arm. She couldn't move it forward, she couldn't move it back. And Doc has done a lot of work on her, and she was starting to get some really good results. She's been doing almost 4 weeks, almost a month with our MMT, and she's like, can you believe it? Can you believe how far back I can go? How far up I can go? And she's not all the way up yet, but she's pretty close. And she's so excited. She said between the two, she said the way they work hand in hand is amazing. So I know for me, I tore about 2.5 months ago, 3 months ago, I tore my rotator cuff. I was just throwing a book into the back seat, and I heard it pop and just searing pain. And so when we were being trained on this, I'm sitting in there and everybody's like, do my hips, do my hips. And I'm like, I have a rotator cuff tear. Can you do anything for it? And at the time, I could go to about here with no pain. I could go back to about here. And that was about it. And it hurt all the time. Doc can tell you, it was agonizing all the time. He worked on me, and for the next 7 hours, I could go all the way up, I could go back, I could do so much, just like you just saw me do now. I've been having it worked on me for about 5 weeks now. Now, it's still painful to do it, but I can do it where I couldn't before. And I can do it without having the treatment first now. And so for me, this whole thing is a gem and a lifesaver for me. And because I do not want surgery on it. I would rather use this and let the tear heal itself. So for me, this is my doctor of choice.
Mhm.
No, my surgeon of choice right here. Okay, so Audrey also has a rotator cuff issue. I don't know if it's
Both of them.
torn,
Mhm.
and so, but is it torn?
I don't know. I haven't ever.
But she has real issues with it. So I'm going to just show you what we do on me, what we do on our patients. And I do it on Audrey too.
I've seen incredible improvement, and it's messing with my mind a little bit. I have a massage gun at home, and so I was doing the exercises and doing the massage gun, but it doesn't really do anything with just a regular gun because it's not the frequency that you need.
Mhm.
So you gotta have
You gotta have it. So
Which one's the worst? Which
this
side?
one, but it's both of them are both. So
Let's do
we
the,
can
let's do the
worst
worst
one.
side.
Okay, so can
Go ahead
we
and
switch
show.
you over just a little bit?
Go ahead and show
Okay,
the
so,
range.
okay, so my range is pretty good. It's just let's talk about the pain.
yeah, okay.
The pain is good. The pain is a 7.
How far back can you go? Okay,
I have
hold it
really
out
good
to your
range of
side
motion.
for me.
Okay.
And go back. Okay, we're gonna get her a little more than that and see if we can get her without some pain, okay? So this one is very simple. She's just we're gonna start out with her arm just down, and she's gonna rotate her hand, thumb in, thumb out, okay? I'm also gonna use a setting that starts with 14 hertz of force that goes up to 20, and you'll be able to hear it ramp up as we go. Okay. Hear it ramp. And again. Okay. So we do the back of the shoulder and the front of the shoulder. Okay, now I'm going to have her bring her arm out to the front, Yep. Same motion, she's going to do in and out, okay? I am not pressing on her, I'm letting the gun do the force. Okay,
That felt good. I
Yeah.
mean, I could feel it changing, the motion becoming easier.
okay,
In
arms straight up.
Oh, nice.
Yep. This one is usually pretty painful on Audrey, especially when I go to the front.
Everyone's like, it doesn't want to bend.
Okay. Yep, gonna let her just kind of relax that a little bit. Now she's gonna go straight out to the side. And when we do this one, I'm actually going to do some resistance on her, okay? I don't start with resistance, but after they've been doing it for a little bit, and I do it on the second ramp, okay? Okay, she's gonna push up against my hand,
I like the resistance.
okay?
It feels good in a sick kind of way.
Now this one, she has to pull down for her resistance, sorry.
You get a workout.
Well, I do get a workout, and what's hard is I come home and my arm aches sometimes because that's the hand I'm using for the resistance. And, but there's no way 5 weeks ago I could have done that. So, okay, her last one, arm is gonna be straight out, and she's gonna put it back as far as she can, and I'm gonna have her do her resistance against my hip, okay? And again, on the second ramp. Okay, all right, resisting. Okay, now we're gonna come in front, and she's gonna pull this way against me. Not yet, though. Okay, go on back. Okay, here we go.
It actually makes it easier with the resistance. It makes it easier to move my arm, where before it hurt. That's
Okay.
crazy.
All right, now, give me your range of motion. Okay. Okay.
Oh, that feels good.
Yeah, okay.
It didn't have that snap catch.
Uh-uh.
Ah,
Okay, what about out to the side?
yeah.
And going back? Yeah.
What a relief.
Okay, all right. I'm telling you, it's pretty amazing. Okay.
And I'm not faking it, you guys. This really is like nice.
So I'm gonna have you stand up. So I'm going to do one of our knee ones. This is one, some of our, so the average age of our patients who are doing this right now, we have a few younger ones, but our range right now is between 60 and 80. Okay, we have a couple that are a little over 80, but yeah, it's pretty amazing. So she's going to do just a knee squat. This is one that is for the knee. And a lot of them, I say we're going to do a squat, they're like, I can't squat. And I said, no, you're just going to just a quarter, just a little up and down. Okay, I'm going to have you turn this way just a little bit. There you go. Okay, all righty, here we go. Normally, I would sit on the bench. Okay, and then we're going to do the inside of the knee because we want to work both sides of the joint. Okay, go ahead and bring your other foot up this way. Yeah.
Okay. Give her.
Yep. I hold the knee on the other side just to steady the gun, otherwise I would slip all over, especially when you got a little bit slick pants on. Okay, now the other thing that Audrey deals with is tendons. Her Achilles tendons tighten up. Audrey's a dancer, and those tendons tighten up really bad. Which one is your worst one?
Today it's the right one.
Okay, so we use a book. Okay, sorry. Okay, yeah, we will do it this way. And I'm actually going to work, I'm just still a stool. And we're going to work a couple points on her tendon here and here, okay? We're gonna work both of those. And if you noticed, she's always in motion, okay? In everything we do. So.
That's the trick, isn't
I
it?
want something to hold on
She's good. So she's lifting.
Because you made me well enough I can do this.
Okay, here we go. Okay. Her toes are lifting up and down. Okay, go a little higher. And I'm gonna go one higher. Just because sometimes those calf muscles can tighten up too when that Achilles tightens. Okay, all right, I want you to walk because you said it was tight today.
Yeah. That took all the sting out. The sting is gone. And I will sleep tonight. I'll wake up a little sore, tight in the morning, but it has progressively gotten less tight every single day. This one is good. It was both. I was walking around going, oh my.
So the other thing that I notice is, even though I'm a little sore after I get the therapy done at first, progressively the next day and the day following, I hurt less and less and less. And then all of a sudden it'll start feeling a little tighter again, but as I go along, it's getting better and better. I want to show you another fun one, but and this will be the last one, but I'm going to do this one on Doc.
Okay.
Okay? Come here.
I'm scared.
You should be scared.
So, this is our hip flexor test, okay? So, our patients, when we do the original EV, they will step on it right foot and left foot, okay? So if you will step on that. Okay, now, can you see it, Audrey? Okay, so I'm gonna tell him he's gonna move his foot out as far as he can without opening his hips up, because that's not fair. He could open them and get them all the way. I wanna know what his hips will do without him rotating, okay? I wanna know if he is to fall, that he's gonna have good hip flexion to be able to catch himself if he falls, okay? So I put my hands on his hips to make sure he is not opening up. We're gonna do left foot first, okay? That is at 60, and the right foot, which is at 60. Okay, now I'm gonna use the therapy gun. Come off of that, please. Thank you. Okay. I'm gonna
Woman
work.
with a gun, that's 5 to life.
I'm gonna work his hips front and back, okay? And I'm gonna do resistance against it, okay? And then we're gonna retest him and see how he does, okay? So you're gonna see this in real life, and I'm either gonna make a liar out of myself or we're gonna show that it actually works, okay? All right, so while I do this, he is going to, I'm also going to use a more powerful setting because he's a man, a lot of muscle to get through, okay? So he is going to move his foot in and out, okay? Okay, go. Okay, push, push. Push my foot. You're stronger than that. Okay. Now I'm going to do the other side. It's kind of a wimp. I got old ladies who can move my foot further than he did. Okay. In and out. Okay. Push. Go. Go. Okay. And that's exactly, Audrey can tell you, that's exactly what I say to him too. Push my foot, go. Okay, here we go. Okay, push it, get my foot out of the way. Whoa. Okay, all right. We're gonna pull our board back. And I'm gonna bet he goes further because I already saw it on that one. Okay. Can you see it? Okay. All right. Okay. So he was at 60 on both of his feet. Okay. Left foot. Okay. That was a little, well, he was actually almost at about 55 last time. That's at 60. Let's go the other one. Okay, go. Okay, he went to 80 that time. Okay. He was also trying hard to push me on that side than he did the first time. So, and the thing is, I did some reevaluations today. First time, our first 2 patients that we got to do our reevals. It was their 8th visit. So they've been doing this for a month with us. And on both cases, every test, with the exception of an area that I had not been working, improved. And so I know now what areas I need to work to get more improvement. But all the way around, from their balance was better, their cognition was better, their range of motion. I had a gal who, one of our tests, if you remember, she's seated and she has to cross her leg over the top of the other one. And she couldn't do it in her initial. Had a patient who, this one's hard for me, who could not even do that and actually touched her hands today. So I know it works. I'm seeing it every day that I work on patients, and I'm so excited for it. We can help you too. Don't be one of those who has a fall going, dang it, I should have done that. Don't let your parent be someone who slips away because cognition has gone towards Alzheimer's. Let us help them now, where we can help improve. One of my gentlemen on a cognition test scored a 7, counting by 5, having to find him and touch him. Today, he got 12. His wife, the first time, did 12 and got 17 today. 20's the max on that one. So I see it, I believe it, and I know that this can help you. I know that we can help you or your loved ones have the life that they need to be able to live their dreams, that they can have the youth again, to be able to do the things, to enjoy their grandkids, to go to baseball games, to travel to Alaska to watch their oldest grandson graduate, like we'll be doing in a couple of weeks. My goal originally was to be able to rip and skip with my grandkids. And at 62, I tell my patients, shout it loud and proud. Tell them how old you are and let them go, whoa, this can be your life too. Let people go, whoa, you're pretty sharp for your age. Wow, look how much balance you have. So you can message me on Facebook, Melissa Elmer. You can call the office, 702-798-1112. Guys, the evaluation is free. It doesn't cost you
It's
a
$180
cent.
value, and right now, currently, we're doing it to introduce these technologies.
For free, okay? You don't have an excuse not to. So, guys, we appreciate you, and remember, a stumble is a fall that hasn't hit the ground yet. Good night.